The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to another Learning Lunch hosted by Format Approved. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I will be your host for today's session. Today's session is called Making the Most of Front Office Technology, and it's sponsored by Care 360. We're very thankful to them for making this event possible. Our presenter today is Laurie Morgan of Capko Morgan. You can see her bio here. Thank you very much for joining us, Laurie.
Thank you. Thanks for having me.
Well, Laurie has been with us before, and she's a great speaker on these subjects. Today, we're going to be focusing on the front office side of things, but she has a breadth of experience and a long depth of experience as well in the industry that will serve us well as we explore this topic today. So thank you again for joining us. While I mentioned a couple of housekeeping notes, I'll let you look at the questions we're going to cover today. So read those through. As I just mentioned, that people always ask us if they can get the slides and the video for the event. Rest assured that we are recording the event, and when it's over, you will soon thereafter get a, I'm sorry. Someone just told me I forgot to share my screen. Let's go back to the bio. I apologize. Let's go back to the bio so you can see that information. Oh, you'd think I'd never done this before. My apologies, folks. Anyway.
I thought it might just be me.
No. That's why we have technicians backing up the incompetent mediator here. Anyway, there you go. There's her bio. And what I was saying is that people always ask for the recording and the slides from these sessions. Rest assured that we're recording, and now we even have video in the recording, and you will get an email after the event and be able to see watch the video, share it with friends, and you'll get the slides as well, which can be a good resource. Also, if you have questions for our expert, you can ask them at any time by typing them into the chat area. We usually hold those questions for the end, but we have set aside time for you to ask those questions and get answers to them. So do take advantage of this unique opportunity to ask questions of our expert. So we'll just go right into the questions and get started. Thank you again for joining us, Laurie. I know I've said that a couple times, but it really is a pleasure to have you with us. Why is now the time to focus on front office technology? Has something changed?
Well, first of all, thank you very much, Brian. And yes, I think that in a way things have been changing for a while. We're sort of seeing several really important trends kind of come together, and that's why I think it's a really valuable time to focus on technology for the front office. And by the way, my terminology here is really about technology related to your practice management system and anything to do with the scheduling, checking in, even the billing and collecting from patients. So that's kind of how I'm using that term front office, basically anything that isn't the back office, clinical side, which tends to be more focused on EHR technology.
Sure.
So, so the trends I'm thinking of, there's been a lot of innovation in practice management technology, and I think that it's almost like it went along a little bit quietly. I think for a long time, most of our practice clients were so focused on the EHR and on getting that working properly and then choosing the right one and going through some kind of conversion that, the practice management side of, the administrative side of the practice kind of got a little bit ignored and was just sort of chugging along. I think those systems also have been in place in most practices for longer. People have had billing systems for longer than they've had EHRs. And so, they just kind of got used to the way that they work. But, meanwhile, there has been actually quite a bit of innovation happening, and a lot of it can really help practices serve patients better and serve themselves better too. And, usually these tools I'm going to talk about today are really reliable and easy to deploy. I think sometimes practices hold back because they're remembering what it was like to convert to a new EHR, and they're afraid that deploying another piece of technology will have some of that same, some of the same challenges, some of the same potential for disruption. And really the kinds of tools I'm talking about today are not like that at all. They're usually very reliable and easy to work with. And of course, probably the single biggest trend that's driving some of this and that helps make it, in my opinion, a perfect time to really look at your tech setup is insurance, and how much has changed in the past 5-10 years. I mean, if you ask anyone who works in a medical practice, a physician, practice administrator, practice manager, billing person, they will all tell you that the insurance trend that's really impacting everybody is high deductible plans. And, the IRS defines a high deductible plan as a plan with the $1,300 or more deductible for individuals. I think it's like $2,600 for families. And I mean, I'm sure everyone on this call knows that actually many people have deductibles much, much higher than that, especially if you've checked out one of the exchanges. You'll see that the exchange plans tend to have much higher deductibles than that. And even people who have insurance through their employers are seeing their deductibles rise. The Kaiser Foundation does a fantastic study every year of employer insurance, and they found that over the past 10 years, the deductibles that employees face on average have now hit that $1,300 mark, and that's up from only about $600, back 10 years ago or so. So it's a very big deal for everybody, for patients and for practices. Most people have a deductible, even if they're on an employer plan now, and those deductibles are going way up. And that means that, first of all, it's a big concern for patients. And second, of course, it's a collection challenge for all of us. We have to figure out how we can collect this money effectively without undermining, without damaging that critical patient relationship. And, as I'm going to talk about today a little bit further into this presentation, technology can be a huge help towards that goal. There's another, go ahead. I'm sorry, Brian.
I was just going to say, I was just going to interject that I know for a lot of practices, I mean, I'm not going to sugarcoat it, collections is kind of a mess. I mean, I've worked with some of them, and there's a lot of challenges around that. They're not really very good at collecting on
That's right.
bills. But go on.
It wasn't, a lot of times the people who are tasked with collecting, because they're the only ones who have the opportunity to do it, didn't necessarily get into the healthcare field, because they thought, oh, great, I'm going to have the opportunity to ask people for money.
Right.
That was their goal, right? They wanted to help people. And so it can be very difficult for some employees to do that. And also, oftentimes it's hard to know, what to collect, what has to be collected. And so technology is really evolving to help with that particular problem. Another challenge is that with the rise of the exchanges and just more consumer awareness of their health plans and deductibles and other things they need to be concerned with when choosing a plan, people are switching a little bit more frequently. And that in turn means that verifying eligibility is more important than ever. So that's another thing where technology can really help. And even your pre-authorization in primary care practices where they need to refer to a specialist or just order medication for a patient, pre-authorization can be a big burden. That's another thing where technology can really help. So these trends really have spurred the technology industry to start to improve and focus on some of these things and deliver better tools. And many times, the tools that can help you are already inside the practice management system that you have. It's just they need to be activated, or you need to understand better how to use them. So sometimes there's a small cost associated with these things. Other times you may not even have to pay anything at all for them. And then the other thing, the other big trend, I think, is the insurance trend, which is, as you mentioned, Brian, a huge challenge for practices. The huge challenge of collecting and at the same time maintaining a positive relationship. And then we have the changing expectation of patients, the expectations of patients. I mean, everyone is getting used to doing things electronically, doing things on their own time. The 9-to-5 culture that many of us older folks grew up with is kind of giving way to a world in which the smartphone in particular has allowed people to conduct business 24/7, and they can do it when it's most convenient for them. And, practices have to be prepared for this, right? Right now, you have millennials that are really insisting on doing business this way. They don't necessarily make up a big proportion of many practices' patient bases, but they will. And if you are in OB-GYN or pediatrics, these patients are coming of age, they're having children, you are going to, start working with these patients more frequently and, coming up against the expectations they have. And so it's a great opportunity actually to think about serving those patients better and meeting their expectations better, because that will only help you be more prepared for the future as well. As these patients age, they're going to take these preferences with them. They're not going to want to go backwards to a world where they have to do everything by phone. They've already, given up this idea of doing everything using the telephone. And they're also kind of spreading those trends among older people. A Pew study found that more than half of Americans have a smartphone. So it's not just a younger person's trend. Older people are jumping onto this bandwagon too. And so being more open to using technology in the front office can really help you serve younger patients better and prepare, for the patients of the future.
I think that's a great point, that it is spreading. I mean, I'm a Gen Xer myself. I'm kind of a techie person, but for routine things, I don't really want to talk to a person unless I need to. And in many cases, there really is no need to talk. If you're scheduling, you don't necessarily need to talk to someone.
It's regarded, I think, correctly as a little bit of a hassle, right? If you have to call during only a certain hours to talk to a live person, it takes longer. And
right.
You can.
And we've gotten spoiled because we're used to being able to just do everything through the computer. So,
absolutely. I mean, if you think about it, you can schedule a manicure, online. So, it seem strange that you can't do that, have that same convenience with your physicians. I think that's how a lot of people view it.
Medicine's a little bit behind the curve on this.
Mm-hmm. Exactly.
So give us some examples. You've definitely made the case for this. What are some examples of technology that practices need to explore?
Well, so I have quite a few, of course, and they kind of tie back to those trends I was just talking about. In terms of platforms, and I think of your EHR and your practice management system as platforms that other types of technology kind of snap onto. And one of the most important things, I think, is the cloud. The cloud has really allowed many of the innovations we're going to talk about to happen because they've just made it easier for tech companies to roll out enhancements to their systems much more quickly. And you don't have to go through a massive upgrade. Usually just a little piece of software is downloaded onto your computer if you're using a cloud system. And so it has really helped to speed up innovation. Also with cloud systems, much of the time they're already integrated. I'm sure that many of the people listening in have an integrated system already where the practice management system and the EHR talk to one another, and you can enter the demographic information in the practice management system and it's shared with the EHR, and in the EHR the physicians can enter the claims information, do their coding, and that transfers automatically over to the practice management system. Now, if you do not have that kind of integration, I think it's really important that you plan to get it. And the reason for this is that, first of all, it's so much more efficient if you can enter information in one place and then have it populate in all the other places someone might want to look at it, rather than having to enter it over and over. When you have to enter it more than once, of course, that's double the work, but then on top of that, you've increased the likelihood of an error. And then when an error occurs, you have to track down all the different versions of that data and figure out which one is wrong. So it becomes very inefficient and time consuming. In the tech world, they refer to this as a single source of truth, where basically there is one place in your entire setup where an important piece of information is maintained, so that you always know that it's correct. Or if there's something wrong with it, you're going to figure out what's wrong with it and correct it in that one place so that everyone can rely on it. So if you don't have an integrated system at the moment, if that information is not passing seamlessly between your EHR and your practice management system. I think it's really something to plan for and look for. That may involve a conversion to a different type of system, or it may not. Sometimes we work with practices and they are not sure whether they can integrate two systems from different vendors. Well, in many cases, practice management systems actually do integrate with multiple EHRs, and so you can talk to your vendors about that and find out how much more integration you can have. The other thing, of course, is that the systems evolve, and so even if you weren't able to integrate a couple of years ago, you may be able to now, or you may be able to work with an outside developer to set up a linkage. So I really feel like this integration thing is absolutely critical. I know that many practices have already done it. If you haven't, it's really something to look at. Now, the next thing I want to talk about, of course, is insurance solutions, because I mentioned right up front how important dealing more effectively and efficiently with insurance and patient payments has become. And some of the best tools available for dealing with insurance are usually available already inside the practice management system you have. Sometimes people aren't using them to the fullest. Sometimes people aren't using them at all because they had different ways of doing things and they've kind of stuck with them. One of the most powerful things inside most practice management systems is real-time eligibility checking. And basically how that works is that when you are inside a patient's demographic record, you can actually just click a button and talk to the patient's health plan, or the system will talk to the patient's health plan, and it pulls back the information about whether the patient is eligible, and it returns what their copay and deductible are. And it's so much easier because that response, first of all, it's coming right from the health plan. You don't have to exit the system and go to another system to look it up or go to the payer's website. And then it is populating a field inside the system with the confirmation information so that you don't have to enter it manually. It's a massive improvement in efficiency, and it also gives your staff a lot more confidence that the information that they have on hand is correct. It gives your staff the chance to say, oh, you know what, Mrs. Jones, I see that you are eligible, and I see that your deductible is $1,000, but that's not going to apply today because you're coming in for a preventive visit. So, you have a lot better information at your fingertips when you're scheduling that patient appointment. Another category of technology that I think every practice should be looking at is on the payment side. I mentioned that, millennials and all of us really are becoming much more mobile. And one of the huge trends that has happened over the last decade is that people are paying their bills electronically. They prefer to pay them electronically, and they're doing more of their payments electronically. And there's some really amazing statistics about this that kind of show the impact of this trend. One comes from the post office, of all places. The post office has found that the single-piece stamped mail has declined by about 60% since 2006, and they credit this pretty much entirely to people no longer mailing back their payments, to their creditors. They're no longer putting those checks in the mail, and it has dramatically decreased their volume. And for all of us, that has a couple of implications. I mean, first of all, if we're not allowing patients to pay online, if we don't have a payment portal, if we're not sending them electronic statements, then we're out of step with what people really want to do, right? Well, we're out of step with their more modern habits. But then on top of that, being out of step is not just a marketing problem. I mean, think about it. If a person is paying every other bill electronically and yours comes and you are asking them to mail them back a check, that person is probably not going to have a stamp in their house. And that means it's going to take them that much longer, right, to get that payment back to you. You're making it much harder for them to pay. They're going to pay less promptly.
I was just thinking, ask a millennial to find their checkbook. It might take a while.
I know. Well, it's funny that you say that because there's another statistic that I think is just fascinating, and it really ties into this, and that is that Google has found that people they're increasingly less likely to know how to write a check. There's a search that people are doing. How do you write a check, right? And it's tending to happen when tuition bills are due, around the beginning of the year, because younger people really don't know how to write checks. And so
that makes perfect sense.
Doesn't it make sense? So if you've got people who don't know how to write a check and they don't have stamps on hand, you're really swimming against the tide of getting paid if you're expecting them to pay that way. And then, the final area of technology I think people should really be looking at is patient self-service. Are you allowing patients to schedule themselves? Are you allowing them to get reminders in a way that is the most comfortable for them? Most people prefer to get an email or a text reminder rather than a phone call. A lot of times people don't even answer phone calls they don't recognize. So, it's a win-win if you can accommodate this, right? Because the patient's going to be reminded more effectively, and they're also going to be more satisfied with you. And then, similarly, check-in solutions, things like tablets and kiosks, these are things that people really value because they offer more privacy and more feeling of control. They also take some workload off of your staff. Again, so this type of solution is really a win-win.
Yeah, nothing, seems more absurd to me. And I see this all the time than going into a doctor's office and you've got this old Xerox form on paper that you fill out, and then someone immediately takes that and starts typing it in. It just doesn't make any sense anymore.
Right. And, some of those tablet and kiosk solutions do allow patients to enter their own data. And you know what? They're more likely to get it right? Because you don't have to, they don't have to worry about reading their own handwriting and have, their own messy handwriting on those Xerox forms that you're talking about.
Absolutely.
So it gives them privacy, takes some of the work off your staff, and then it also improves accuracy.
So you mentioned how important the cloud is earlier, but why is it so invaluable?
Well, I do want to talk a little bit more about the cloud because I do feel like many of the practices we're working with are considering making a switch. More vendors that had in-office server-based systems are offering the opportunity to switch to the cloud. And I think it's something that practices should really consider. One reason is that a cloud solution has a built-in kind of redundancy to it. And what I mean by that is that we think of the cloud as this one place, where data is stored, but in reality, the cloud is lots of different locations with lots of different servers, and the information is distributed across all of these different parts of the network. And what that allows is that if one machine goes down, one server goes down, you might not even realize it. If you're working along, the workload is going to automatically get shifted. The computers or the server's workload gets automatically shifted to a different server, a different location. And so you can keep going. And of course, that's something that is impossible with your own server in the office. So I feel like we're relying on these systems so much more. Having that extra level of reliability is so valuable. The other thing is that, practices often ask me, well, what about security? I'm not sure that data up in the cloud is really secure. Well, security, of course, is a very, very big deal. But the thing about the cloud is that, you have thousands of tech people who are working to secure various levels of the cloud. And then, of course, even at your system vendor, right, your EHR, your practice management system vendor, they're going to have many people whose main focus is making sure that data is secure. That's something that you can't really replicate in your own office. The other thing is that, data security, hacking, et cetera, is one risk, but another risk is just the risk of a natural disaster. Here in California, you may have heard, just north of where I am, we had these terrible fires out of the blue. A week or so ago, buildings were just burnt to the ground. And if you had your server in your office and a fire like that happened, there's no way you can get in there and get that information. And, many of you probably, if you have a server-based system, you may be very diligent about backing up, but sometimes backups are not that reliable. They're not able to be restored as reliably as we would hope. So by keeping that information on the cloud, you actually have a lot of protection against a flood, a fire, even theft. Someone could actually come in and steal your server. I mean, I'm always telling our clients, it does happen, and your data is really only as secure as your office if it's on a machine in your office. Of course, I mentioned before the updates are much easier, and because the cloud system is inherently remote, I mean, everyone is really accessing remotely. If you have a doctor that wants to access remotely, or your practice manager you want to access remotely, it's so much easier because that's how they're set up. And then, of course, in the little thought bubble over here, I think that oftentimes these types of systems are easier to get started with, and it's usually just a piece of cake to add users. And so, that's really valuable if you're starting a new practice or if you're switching to a new system. It's much less difficult than adding someone to a server-based system sometimes can be.
And you don't have all of these high capital requirements to get started and all the other things that come with it. Well, and
personnel too. You may need to have a tech person.
Well, I completely agree with you about moving to the cloud. I urge people for many of these same reasons to consider it, and you made a great case for it.
Thank you.
So how can adding technology then improve patient service?
Well, a lot of times when we work with practices, they think, well, don't people prefer to deal with a person? And as we've been talking about, Brian, not always, right? I mean, sometimes you just want to get a simple task done quickly, and the quickest way may not be to work with a human. So that's one reason. I think there's just a little bit of an assumption that may not be correct, or may not always be correct, that having human intervention is always helpful. And, one of the biggest things I think that can really help improve patient service is addressing the huge problem of surprise bills. I think there is nothing that makes a patient, gives a patient a worse taste in their mouth than getting a huge bill that they weren't expecting to receive. And even though that bill is basically based on the plan rules of their insurance carrier, they're still probably going to hold your practice accountable for that, right? They're going to feel bad about your practice because they've been zapped with the surprise bill. And it's a really big problem. Your Consumer Reports did a survey, and they found among patients that have plans through work, so we're not talking about Medicare or Medicaid, among patients that have plans through work, more than a third had reported that they had been surprised by a medical bill that they weren't expecting. And the other, big thing there is that if they're not ultimately convinced that the bill is correct, then in many cases they don't pay the bill. So if technology can help make it clearer to patients right up front what they're going to be expected to pay, first of all, it alleviates a lot of anxiety, both for the patient and for your staff. And then you're preventing that really terrible experience of getting that surprise bill. You're also potentially making it easier for them to pay because you're warning them about it. And then with technology, you can offer them some kind of an automated payment plan or put their credit card on file so that they don't have to, get that bill in the mail every month and have to deal with it. Maybe they get an electronic statement, but they know what's coming and they know how much they have to pay. I mentioned with the millennials and many of us, even older people like me, and I know you mentioned you too, Brian.
Definitely.
People actually, you prefer to help yourself, right? I mean, I think it's fascinating because it's a total win-win. You're letting people help themselves. It's reducing your workload. It's eliminating some errors, and then people are going to be happier with you as a result. I mean, what a win-win. I think that technology that allows people to help themselves often provides not just convenience, but more privacy. For example, with those, tablet and kiosk type systems, people can enter the reason for their visit without having to say it out loud. They can also set themselves up on a payment plan so they don't have to have that conversation at the front desk where the front desk person has to try to quietly tell them, oh, Mr. Smith, you actually have a significant balance. I need to collect something from you today. I mean, there may be other patients in line that can hear that. It could be very uncomfortable for the patient, very awkward for the person at the front desk as well. These tools that allow people to do it on their own are really a big relief for patients in that position, and they also increase the likelihood that you're going to get reliably paid because they allow that patient to set up a payment plan that's comfortable for them and they can pay automatically. The other thing is that I think the human touch is absolutely essential and valuable in a practice for sure, but it has to be the human touch applied on the right things, right? Or in the right opportunities.
Yes.
If it's making you less efficient, then that's kind of self-defeating, right? You want to make sure that you're operating as efficiently as you can be, that you have great information available for patients, and you're making the administrative side of things easier. And then the human touch can focus on the clinical side of things, or at least on the the warmer human side of things. So becoming more efficient is always going to allow you to give better service because it's just going to make you easier to interact with.
Yeah, there's no question that there's times when you need to talk to a person and the person needs to be available, even in a front office situation. But there, like you're saying, there's so many times where it really is not necessary, and it's easier for everyone involved, as long as they're comfortable with it, to use these systems rather than have to talk to a person, which can be, for some things, unnecessarily cumbersome.
Absolutely. Absolutely.
So does this mean we're going to axe a bunch of people because we don't even need front office staff anymore? Or to put it more formally, should practices downsize as they have automation?
I love that because I do feel like sometimes when I talk about automating the front office more effectively, that is the first question that people have. Does this mean that we should downsize, or does it mean that we can downsize, right? I think many practices are really focused on minimizing the size of their staff. And I have to tell you, I find that this is usually a mistake because staff can really make your physicians more efficient, and they're really able to make everything in the practice more productive. I think being understaffed causes a lot more problems than being slightly overstaffed. So that's why I say probably not. I think that what we see is that over the last 5-10 years, as collecting has become a much bigger hassle, as reminding patients and dealing with no-shows and trying to get a good handle on eligibility has become more labor intensive, other things that are really valuable have been crowded out. You don't have the time to spend a few extra minutes with that patient, making them feel welcome. Even with new patients, there isn't that opportunity to spend a few moments talking with them and reassuring them. I mean, we have to remember, sometimes our patients are really not feeling well. Sometimes they're scared. And so that extra human touch that has been lost, basically, because there are just too many other tasks now to do at the front desk, can be restored if we make some of the processing work more efficient. Even things like just watching to see if someone has been waiting too long and troubleshooting that with the back office. Those are the kinds of things that in many cases there isn't enough time for anymore. And so if we can restore some of that really valuable human touch, that can really help us with patient retention and with good word of mouth, et cetera. The other thing is that we see a lot of new needs, that aren't getting handled as well as they should. One of the most important things is reputation management. For example, that's asking patients if they are able to write a review, or encouraging them to write a review, or more fundamentally, just making sure that your doctors have correct information online. In so many cases, we find that even payer directories have incorrect information about physicians. Everything from their specialty to their address to anything can be wrong in those directories. And when that happens, it's like you're sending new patients away. And that's something that someone on the team could be working on if a little bit of time was freed up. Social media is another great example of that. And then I mentioned, well, actually, two final things. So one of the big challenges with keeping up with technology, and one of the reasons why I'm talking about it more in presentations like these, is that it's not that easy to keep up with all the change. I think that for practice administrators, for physician owners, for anyone in management inside the practice. It can be really hard to keep up with all of the changes that are happening. You know, most practice management and EHR systems send out so many messages over the course of the year, so many release notes and messages about new features and updates. And I know that a lot of times those messages tend to get ignored because they're just not a high priority during the day. Well, if you have a little bit of staff time freed up, someone on your team who's really interested in technology, who's really great with your systems, can actually take on that extra responsibility of staying on top of technology. Make that person your technology liaison, or the liaison to your primary practice management system vendor, for example. They can learn about what's coming down the pike to the benefit of everyone in the practice, and it also gives them a chance to grow and try something new. And, you know, as your employees are growing and becoming more engaged, you're thinking of new ways to kind of expand their roles or give them more credit for the different kinds of things they're able to do. You can get people more engaged in their work, and that in turn really helps increase productivity. And, you know, we talk a lot about staffing being so critical to physician productivity, and of course, that's usually focused on the back office, right? We want to have enough MAs or nurses to support our physicians and make sure they're focusing on their most valuable tasks. But, you know, front office staff can make a big difference in productivity too. I mean, a couple of examples, you know, sometimes when the front office has just gotten way too overburdened with collecting and related activities, things like calling patients for recalls or setting up automated recalls aren't done as frequently as they should be. Or even things like maintaining a wait list. You know, a lot of practice management systems have a wait list feature inside, right inside that platform. And most practices we work with aren't using it. It can become a really easy way to give extra service for the patient and also keep the schedule full. So, you know, even the front office can really contribute to overall productivity. And it's great if technology takes some of the more tedious tasks off their plates so that they can focus on these things that add more value.
So how do we then evaluate the return on investment of these technology add-ons?
Well, I think the biggest pitfall here is just to not reject something new because it has a cost. You know, sometimes when a practice looks at something that's inside of their existing system, you know, maybe they have to spend a little bit of money to activate that tool. For example, if there's a patient payment portal that can be activated, or you know, in rare cases, something like eligibility checking might have a cost to it. And I think that there's sort of an immediate kind of gut reaction, like, ugh, we don't want to spend more money. And you know, most practices are very cost conscious. So I think the first thing is to just open your mind to it, because in most cases, the costs that are offset are so much greater, even when it's not always easy to calculate them, you know, or it requires a little bit of thought to calculate them. Now, sometimes there's a direct cost. For example, if you can send out payment notices electronically, and usually that takes the form of a message that goes out in email to the patient telling them to go look, you know, in the payment portal to see what their balance is and to make their payment. That eliminates a lot of direct costs, right? We've got paper, we've got postage, we've got the time it takes to stuff those envelopes and mail them. We've got the time on the back end, because so many of those patients are calling in to provide a credit card because they don't want to go and find a stamp and send a check. So first of all, those direct costs are usually, you know, if you just sit and think about it a little bit, you can come up with direct costs that are offset by technology. Remember some of the things that are a little bit more difficult to calculate, but are still really valuable. Handling of data. You know, if you're handling credit card data and someone is having to jot that information down on the phone and then enter it again into, you know, your system to charge the card, first of all, there's another opportunity for error there, which creates more work. And there's also a risk of some of that data, you know, potentially being stolen, just because you now are, you know, having it in a form that's easier for someone with a, you know, nefarious kind of intent to grab it. So There's both a handling cost there, just the time involved, and then there's more risk.
Yeah,
I mentioned
just briefly, I train people on credit card security as well, and this whole notion of people calling in and then someone writing down their information on a
right.
post-it note or say just gives me, nightmares, because this is really not the way we should be doing things. If there's any way we can avoid this, we should not be doing it that way.
Absolutely, absolutely. I mean, it also ties back to the whole, single source of truth type thing. I mean, with credit cards, I'm going to talk a little bit further in about being PCI compliant, and that's a system that the card industry itself has set up to allow cards to be stored in a way that is lower risk, right? It's stored in an encrypted fashion. So using tools like that really reduces the handling of that data, which also, Brian, I will tell you, gives me hives too when I see people doing that. It's so much more work, and then of course there's more risk too.
Definitely.
Of course, duplication of tests, that's kind of obvious, that creates more work. I think also, this one's a little squishier, but it's really important. If you are implementing some of these things that allow patients to pay more quickly, I guarantee you, if they can pay electronically, you're gonna get that money much faster than if you're expecting them to send in a check or call you with a payment. And that means that your accounts receivable is going to be much more accurate. One of the biggest problems when receivables blow up, as they have been for so many practices over the last few years, is that it's really hard to tell how much of that money is actually going to be collected. And so, your analysis of the financial position of the practice really suffers as a result of that. Adding the ability to let patients pay and get that money more quickly really helps with that. And then, of course, the last item is what I just mentioned. If you can collect faster and more reliably, you're eliminating a lot of costs. I mean, one thing you can look at is how many times do your staff members end up calling patients to alert them to a past due balance. Those calls cost you money, right? That when a staff member is doing that, they're not doing something else that they could be doing that might be more valuable to your practice.
Very good point. So what are some pitfalls in this? There must be some risks involved.
There definitely are pitfalls. I mean, there are so many different tools now in some of these systems, and I think one of the biggest things that we see is what the tech industry calls garbage in, garbage out, or in some cases in practices, garbage in or nothing at all in, because some of the tools are just not being used. And there are a few specific examples I want to share. One is with tracking no-shows. So many times we'll go and talk with practice, and they'll say, well, we run this report on our no-shows, and it looks like it's great. We hardly have any no-shows. But then it turns out that the staff is, very, very diligently calling those patients that don't show up for their appointment, and then they're rescheduling that patient. And instead of that patient now being marked as a no-show, they've actually been rescheduled, and they don't get captured in that no-show report. So much of the time, the practices we work with think that their no-show rate is much better than it actually is. Really important to make sure everybody knows the proper way to use some of these tools. We have another thing that we look at. So many of these systems, especially ones that are really well integrated with the EHR and the practice management system, really talking to one another. Then you have timestamps. These can be so valuable if you can stamp when the patient arrives and checks in, stamp when they are roomed, stamp when the doctor comes into the room, stamp when the doctor leaves, and when the patient checks out. Now, what usually happens is you have the timestamp for when the patient checks in, and you have a timestamp for when the patient checks out.
And who knows what goes on in between?
Exactly. And sometimes those timestamps aren't even that accurate because maybe someone is doing them all at once. And so what happens is you miss this huge opportunity to find out how long they're waiting in that room for the doctor, and also to find out how long the visit actually takes. Now, if you were effectively capturing that data, you could do a great analysis to find out if your appointment time slots are actually as fine-tuned as they could be. You can find out where the bottlenecks are. I think people don't use that tool because they don't really understand the value of it. So, it's up to practice managers to learn about it and then, get everyone on board with using it, especially I think in our experience in the back office, the MAs don't always want to enter that information about when the doctor came in, or the doctor doesn't want to enter it. But if you can capture that, oh my goodness, it can really become a great tool for improving your practice productivity.
That's such an excellent point, because how can you even improve these workflows? How can you figure out where the bottlenecks are if you're not even recording the data? It's like there's no way to even really know if you don't get this kind of granular data that you're talking about.
Exactly. And it's just a missed opportunity. And I mentioned that there are dormant or misused features. A lot of times there's the opportunity to check eligibility in a batch fashion, for example, so you can check it when the patient books their appointment, and then you can run a batch every night that checks the eligibility again for all the people coming in 2 or 3 days. That's super handy tool that a lot of practices aren't using. Usually when it's available, it doesn't carry any extra cost. Sometimes, oh my gosh, I bet you everyone on this call is going to feel like I do, because these practice management systems have so many reports. And I want to tell you that I feel your pain, because whenever I go into a new project, I'm looking at all those reports and trying to figure out the ones that I need, just like you are. And I think it can be really overwhelming. But one of the best things that a lot of systems have rolled out is the ability to design your own report. So you can figure out what you need, and as long as the right data is being captured, design your own report that gives you the snapshot of what you need. Sometimes you can even design your own dashboard as well, so that when you log in the morning, you can see the data that you want to see. I think also sometimes practices are really concerned correctly about HIPAA. Of course, we all have to be concerned about that, but sometimes they misunderstand how HIPAA works, and they assume that they can't do things like electronic statements because they're worried, that might be a HIPAA violation. And the key thing there is that, first of all, you got to ask your vendors, make sure they're all signing business associate agreements, and make sure you understand, how well they understand HIPAA. And I think usually you'll be pleasantly surprised. And then also remember that in a lot of cases, the way these things work is that you're not sending the patient that sensitive information over email. What you're usually doing is sending them a notice saying, log in to this secure area where you can get that sensitive information, whether it's your billing information and payment portal, whether it's the HR portal, even scheduling type information. So usually the HIPAA thing has been thought through.
Yeah, especially for these cloud services. I couldn't agree more that they, and when it comes to like a patient portal, for example, if that's part of a certified EHR, it has to be secure or it wouldn't be certified.
Right.
And so these portals are very secure. They're designed to be secure. They encrypt their data. All the data in transmission is encrypted. And so it's probably actually a HIPAA improvement rather than a risk.
That is a really good point. That's a really good point. I mean, there's probably more chance that a statement could get intercepted, a postal one, than a HIPAA violation happening because you send them an electronic link to get their billing information.
Yeah, it'd be very hard for most criminals or whatever to be able to even get into these systems. They're very secure.
And the key thing is that the information you're sending out to the patient is usually very minimal, right? They're not getting the sensitive information until they're in that secure environment.
Absolutely, and it's certainly not a violation of HIPAA to say, hello, patient, log in here. There's nothing in there.
Exactly.
There's no PHI in there.
Exactly. And I think I talked about missed opportunities like the batch thing. If no one is monitoring what's coming out of your platform vendors, especially your practice management system vendor, if they're sending you release notes all the time and no one has time to read them, then you may be missing out on some good stuff. And I think it's really important to find, someone else on the team who has a real interest in it and let them, take charge of that.
So it sounds, does this mean we're going to really change workflow within the practice?
I think it's really important to be open to it, because I think for many of these systems, it's hard to get the most out of them if you're not willing to change things up a little bit. So I just want to talk about one of the most important changes I think that you should look at, and that involves eligibility checking. I mentioned that eligibility checking has become much more important, and I also mentioned that it has become easier to do from inside most practice management systems. Now, what you really want to do, in my opinion, is have that eligibility checking done when the patient schedules their appointment. So the person on the phone can say, okay, Mrs. Jones, I'm just going to make sure that you're eligible. I'm checking with your insurance company right now. You know, performing that task inside the system usually takes only about a minute. So it's something that can be done. And the information that's returned usually includes their deductible and their copay, and it gives that person scheduling the appointment the opportunity to explain to the patient how their insurance works. And that in turn means the patient is going to be much more prepared to pay when they come to the front desk. Now, that is going to speed up the process at the front desk because the receptionist is not going to have to explain as much. However, it is going to take a little bit more time at scheduling. So I think it's really useful to think about reorganizing some of these jobs, have some people who are dedicated just to answering the phone and scheduling, make sure they're well trained in insurance, make sure they know how to use this eligibility checking, and they can kind of kick off this process of preparing the patient to pay and educating them so that they're not surprised. I mean, this process is such a win-win because, you know, the patient can hear about their insurance, you know, situation discreetly rather than, you know, up at the front desk being the first time they're hearing it, asking all kinds of questions, creating a bottleneck because now there's a long line of people waiting to check in and, you know, feeling confused and feeling like they got hit with this idea of paying when they're just wanting to come in and see their doctor. So shifting this a bit has so many advantages. The other thing, of course, is that it's so much better to know if a patient is ineligible before they've been booked, right? If you book them and then you don't find out until they arrive that they're ineligible, well, then now that patient has come in, they have to decide whether they want to pay to be seen out of network or they, you know, if they are going to go and try to find another doctor. So, you know,
right, that's embarrassing and stressful for everybody.
Absolutely. And in the worst case, of course, you can have a person booked and then find out that they were never eligible and they've received a service that, you know, they either have to pay for out of pocket or the practice will have to eat the charge for. You know, we were working with a practice recently that does Mohs surgery, dermatology practice, and they had a significant number of patients that were on Medicare HMOs, and they said that they were on Medicare. The eligibility wasn't getting checked until after they'd already had their Mohs surgery, and the practice is not a part of those HMOs. So they were absorbing all those costs. It was very costly for that practice. So I think because I'm recommending that you will have to make some workflow changes to really get the most out of this new tech, I think it's really important to prioritize the things that are going to be win-win, and you know, anything to do with allowing patients to pay online and giving them better information about what they're going to owe. These things benefit your practice tremendously because they make collections easier, more effective, and they benefit the patient because they make things easier for the patient and also make them more prepared to pay. And then as you're making those changes and and changing up your workflow, there's going to be a period of adjustment, right, where you're going to have to kind of watch things and see how is the workload shifting. Is one person now suddenly way overloaded and another person, having a lot of free time? And so you're going to have to tweak a bit, but I think it's very much worth it. And adding some of these tech tools is a great opportunity to look at some of your workflow and try to make things more efficient. And then just, prepare to do it in stages and make sure that you're continuing to cross-train so that people can cover for one another.
So we've touched on HIPAA, and you said you were going to come back to this. What are some tips for protecting patient data?
So these are some of my favorite tips. I have a feeling, Brian, you probably even have some of your own that you want to throw in. I mentioned with credit cards. Now, back in the olden days, it used to be considered okay if you kept credit card information in a locked drawer. These days, it absolutely is not okay. Even from the point of view of any vendor, the PCI stands for Payment Card Industry. The payment card industry has a standard of storing credit card information in an encrypted fashion that everyone who accepts credit cards is supposed to follow. But for us, it's even more important because credit card information is also a form of HIPAA information in the sense that it ties the person and their financial information to your practice. And so in that sense, it reveals something about the person's health. So it's really important that if you're going to pursue a credit card on file type solution, and I definitely recommend that you do, make sure that it is PCI compliant. The way that works is that the information is not even stored in your systems. It's actually stored elsewhere in an encrypted fashion, and your system accesses it, and it's the very best protection for that type of information. You also want to make sure all of your systems have the ability or offer the ability to set access levels by individual employee. Sometimes we find that it's everyone's been defaulted to the highest level of access. You really don't want to give anyone any more access to anything that you want them to have access only to what they actually need to do their job. You also want to know what kind of log files are available for you to look at in the event that you think there might have been a breach, so you can see who logged in. And of course, you want to make sure that nobody is sharing their login information, right? Everyone has to have their own login. I mentioned before that with patient information, it's these systems that email out statement information or email out about messages from your doctor. The bare minimum information is going in the email, and then they're being directed to a portal or other secure environment to get the information that you're trying to send them. Make sure that your staff knows that that applies to other things too. That if they want to send a patient a message, it should be done in the portal, and then they can email the patient to say, hey, there's a new message for you in the portal. Make sure everybody knows about password hygiene. Passwords should be easy for the owner to remember, but difficult for someone else to figure out. And then, of course, make sure everybody knows that they should avoid downloading. Just have a rule. Do not download anything that you were not expecting to receive. That includes clicking on a link or clicking on an attachment. If you were not expecting to receive something to download, don't download it. It could be a phishing scheme. Really, really smart people are getting fooled by these things every day. So it's really important that everybody be on the alert. Just don't download it if you weren't expecting to receive it.
Yeah, because that is how people usually get infected with malware, innocently enough.
Yeah.
And, it's interesting, two quick comments. I know we're running short on time, but one is the things you're mentioning about password hygiene and not downloading things. I think every practice needs to have kind of a basic cybersecurity 101 course for everybody, because you just can't assume that people know these things. You really need to make sure that everybody understands. Do not open that attachment if you don't know the person who sent it, or even if you do in some cases. The second point I was going to make is just that the things you mentioned about access levels and not sharing passwords, those are good. That's good practical advice, but it's also actually in HIPAA. It's in the requirements that people are supposed to have more access than they should.
That's exactly right. And the general spirit of HIPAA is, are you doing everything, taking the reasonable precautions that you have to take? And I would argue that all these things count for that as well.
I completely agree. So what are the most important tactics then to maximize benefits from this technology?
So I just want to talk about a few things here, and very quickly, because we are almost out of time. So first of all, so much of what you want to offer to patients to make things convenient for them is going to require having that patient's email and or their text information. And I think that sometimes practices have asked patients for it, maybe 5 years ago or 10 years ago when the patient first started with the practice, and they haven't asked the patient about it since then, and they just assume the patient doesn't want to provide that information. But here's the thing. Over these last 5 or 10 years, we've all learned about the benefits to ourselves of dealing with our bills and other things online. Your patients have been learning about that too, and I bet you if you ask them now, a significant proportion of them are going to change their minds and want to give you their email because they want to take advantage of this more convenient way of interacting with you. So if you haven't checked, if you haven't checked recently, or maybe more appropriately, just get in the habit of checking with patients who haven't provided it every time that they come in. And if the patient's adamant about it, no, I don't want to provide it, of course you can put that in as a note. But I guarantee you that a lot of people will have changed their minds and be much more open to this. The other thing is that whenever you're doing a new initiative, like say, hey, we're going to make a big push to try to collect patient emails, make sure the entire team understands why you're doing it. So like in the case of this email collection idea, make sure they know that they can explain to the patient that this is going to open the door for them to start receiving their payment information electronically, for them to be able to log into a payment portal, to potentially schedule online. All of these ways of dealing with us in a more convenient fashion are going to be triggered by providing that email. So make sure the team understands that, and make sure they appreciate why it's important for them to do it and why we're going through this bit of pain or this bit of extra effort. It's because things are going to be more efficient on the back end. I mentioned before, if you have someone or several people on your team who are really interested in technology, it can be great to assign them this role of being the vendor liaison. It can be a way of recognizing what they're probably already doing. So many times we find that there's a person in the practice who doesn't have the, quote unquote job of being the tech liaison, but in fact, they're the person that everybody goes to when they have a question about how to make the EHR work better, how to fix a template, or how to make the practice management system work better. Even if you can't give that person a raise, it's great for them to have something where they feel like they're learning, where they're really appreciated for a unique contribution, and where they're building their skills and building their resume for their future career. So this can be a great way to honor a person, give them a growth opportunity, and then take some work off of your own desk by getting that really interested person to track all the release notes and other information that is coming out of your platform vendors, and bring the most important ones to your attention so that you can make sure you don't miss out on any really good opportunities. And then finally, I think it's just if you felt like you were burned by a disruptive EHR implementation and you've been shying away from technology because of that, I think it's really important to be open. The kinds of things I'm talking about today are much less difficult to implement, and they offer immediate value for your practice. I want to give just one example, because we've worked with a couple of practices where they didn't know they had a payment portal inside of their practice management system that they could just turn on. Turned it on in the afternoon. It was literally like flipping a switch, calling the vendor, getting it turned on, understanding how to send the patient a notice electronically, and boom, they had money coming in that night. The next morning they came in and there was money in their bank account from patients that paid electronically. I can tell you that was cause for celebration. I mean, that is a good feeling to see money coming in and you not having to do anything really to collect.
Right.
So, just be open, because these tools are really designed much more with the practice's needs in mind. They're not the features weren't dictated by the government. This is much more about how your practice can operate better.
Well, Laurie, we are out of time, and I hate that, because I could sit here and talk to you about this for hours. I really enjoyed this.
Well, I hope you can tell this is one of my favorite topics of all.
Yeah, absolutely. I think you had wonderful advice, and this is a great session. I really enjoyed talking to you. For folks who want to learn more about Laurie and her professional services, do visit capko.com. You can see the URL there on your screen. If you all probably know us, but if you ever are in the need for macro MIPS or HIPAA compliance, you can visit our website at formedtraining.com. And we really want to thank our sponsors at Care360. You can see their URL there. They offer many of the technologies we're talking about today, and we thank them for making this event possible. Do check out their services, because they might be useful to you. So we're going to wrap this up. But again, Laurie, I really want to thank you. This was a very enjoyable session.
Oh, well, thank you so much, Brian. I really enjoyed it too.
All right. Well, we hope to have you back sometime. And for those of you out there listening, please join us for our next Learning Lunch. You can find that on our website. We've actually got one next week. So please join us again, and thank you to everyone.